Good evening, all. I hope you are doing fine, you and your families, and I hope you are safe. Today, I will talk about my clinical case in oral medicine. So, as you can see, all 54 years old white female presented for evaluation for a painful area on her left and right buccal mucosa. Upon taking history and examination, her medical history revealed that she is medically fit and she doesn't take any medication. Dental history: she brushes her teeth once weekly and she denies any recurrent dental work. Upon clinical examination, there was a whitish to red area bilaterally on the buccal mucosa. These areas were tender to touch and there was no any relieving factor and nothing seems to make it better. The patient presented with weight loss and there was no history to trauma in both areas. As you can notice here, the white and the red color in the lesion. This is a closer picture to the lesion. This is a histological section for the lesion by taking biopsy and sending it to the lab. Now for the differential diagnosis, we have lichenoid drug reaction, we have oral erosive lesion planus, we have oral squamous cell carcinoma, and mucous membrane pemphigoid. Does anyone have any idea what is the diagnosis for this case? Now let's start one by one. A lichenoid drug reaction is a reaction to a medication. There are certain types which could trigger this condition, but as we know from her medical history, the patient didn't take any type of medication, so we can exclude the lichenoid drug reaction. Now let's move to the next diagnosis, mucous membrane pemphigoid, which is described as a group of rare chronic autoimmune disorders characterized by blistering lesions that primarily affect the various mucous membrane of the body. The mucous membrane of the mouth and the eye are the most common sites to be affected. The mucous membrane of the nose, throat, genitalia, and the anus may also be affected. The exact cause of the mucous membrane pemphigoid is still unknown. It's mainly characterized by blistering skin lesion affecting the mucous membrane of the body. As we've noticed, the mucous membrane pemphigoid is a systemic disease. It can also affect the gum, which will result in a very red and inflamed gum, which is susceptible for bleeding. As we can notice also in the next slide, the lips also could be affected. But in our case, there was no extraoral manifestation, so we can also exclude the mucous membrane pemphigoid. Now moving to the oral squamous cell carcinoma. It is the most common oral cancer. It affects the epithelium layer in the body. The oral squamous cell carcinoma has poor prognosis and it has high metastatic potential. The tongue and the floor of the mouth is the most common sites. But as we've noticed from the histological section, there was no dysplasia, so the oral squamous cell carcinoma is not the diagnosis. You can notice that it can occur in the buccal mucosa of the oral cavity. So that's finally leave us with one diagnosis, which is oral erosive lesion planus. Now, lesion planus is a common chronic inflammatory disease that affects the oral mucosa with or without skin involvement and other mucous membrane. It affects more women of middle ages. The oral lesion presents as a bilateral white lesion in the buccal mucosa. Skin lesion consists of itchy, pinkish, flat-top papules which affect flexor surfaces of the arm, trunk, and legs. There are many types of the lichen planus. The most common type is reticular type, which manifests as white lacy streaks known as Wickham stria. Now, the erosive type is less common and may occur in multiple areas or in one area, such as the gingiva, and the stria may be seen near these lesions. Now, the danger in the erosive lichen planus, the type that it may transfer into malignancy, so we should treat it and observe it for a long term because it may transfer into malignancy. As you can see from the histological section, there was a pseudomembranous covered ulceration with erythematous border. You can notice that there was atrophic areas with central ulceration from the clinical and the histological sections.